And here is your question. Too long to read in 1 minute. Keep reading. Right. Are you done reading? Otherwise, I can.
Yes.
Read. Okay. So, if you have read and understood, considering the surgical pathology station, kindly tell me what are your differential diagnosis for this patient?
My differential diagnosis, first I will consider DIC, then I will also consider hypovolemic shock, though the BP is raised, but I'll still keep that into consideration, ma'am, considering the trauma.
Since your first differential diagnosis is disseminated intravascular coagulation, can you please tell me what is the pathogenesis behind it? Can you discuss it?
It is a consumptive coagulopathy where there is activation of both the coagulation system and the fibrinolytic system,
yes,
which leads to formation of microthrombi in many organs, and also leads to consumption of the clotting factors and the platelets.
How can you confirm your diagnosis with DIC?
For DIC specifically, I'll do a full blood count, and also where I'll find the platelets reduced. I'll also see the fibrinogen and the FTP levels. Fibrinogen will be decreased, and there will be increased FTP levels. Fibrinogen fibrin degradation product.
Products. Okay. Can you please tell me why platelets are so important?
Platelets. Yes, it is mainly its role is in the hemostasis, ma'am, where because of its adhesive and coercive function, it
give
helps
me
in
at least
formation.
Two functions.
Yes, because of its cohesive and adhesive nature, it helps in formation of platelet plaque, and also it can activate the coagulation system.
Yes. Okay. Can you please tell me where these platelets are formed?
It is formed in the bone marrow from the megakaryocytes by fragmentation under the influence of action of thrombopoietin.
Hormone. Okay, good. Can you tell me why this patient might have the bleeding tendency?
It could be possibly because of liver dysfunction, liver effect, liver is affected.
Why would there be a liver dysfunction? Give detailed answer. Tell me, because patient has had
developed
hepatitis C. Then what has happened? Yes. Yes. Then this can lead to
cirrhosis.
Okay.
And also
hepatocellular carcinoma, which
is a dysfunction of the liver.
Yes, which can influence or affect the ability of the liver to. Please tell what happens in the liver.
Liver to form the coagulation factors, ma'am.
Okay. Which coagulation factors are dependent on liver, if I should put it this way?
Mainly the vitamin K dependent factors.
So which pathway will be affected?
10.
Sorry?
2, 7, 9, 10, ma'am.
Okay. Which pathway will be affected? Intrinsic pathway or the extrinsic pathway?
Mainly the intrinsic pathway.
Okay, why?
Because here the intrinsic pathway begins. Intrinsic pathway begins with the activation of factor 12 due to vessel injury, ma'am.
Okay, good. And this factor 12 is released by the vessel injury, but then, okay. Can you please tell me if you have to confirm that intrinsic pathway is being affected, which test would you do?
I'll do the activated partial thromboplastin time.
Yes, good. Okay, can you tell me which hypersensitivity reactions you know about?
There are mainly four types.
Yes.
We have the fifth type also. The type 1 is the type 1, 2, and 3 are antibody mediated. Type 4
Yes.
is the T cell mediated. And type 1, it is mainly due to mast cell degranulation, which is mediated by IgE and antibody. And type 2, it forms antibody against the antigen. And type 3, it forms immune complex of antigen and antibody. Type 4 is T cell mediated, ma'am.
Okay. When is it important to know about these hypersensitivity reactions? When?
When?
For this patient. Okay. When you have to decide to give blood transfusion. Why this patient has been having blood transfusion?
I didn't get the question, ma'am. Why?
Okay. All right. Our question was, when is it important for you to know about the hypersensitivity reactions? Why is it important for you to know?
Here
Why
patient
should
is
you know?
receiving,
Yes.
here patient is receiving blood transfusion. So we need to do the blood grouping and cross matching. And
Yes.
if and here due to if there's mismatched transfusion, then it might be disastrous to the patient. So here due to the hypersensitivity reaction, there might be the mismatched transfusion reaction.
Yes. Okay. In order for the mismatch transfusion reaction to take place, what factors are important for you to rule out?
We have to do the ABO grouping and RH typing and cross matching now.
Very good. Okay. When it comes for blood transfusion, then how would you define massive blood transfusion?
Massive blood transfusion, it is defined as giving one whole blood volume within 24 hours or 50% of blood volume within 4 hours now.
Okay. For this patient, would you consider giving whole blood or any product of the blood, and why?
Yes, if there's no, if it is immediate and there's no option, I will give whole blood. But if there are other blood products available, specifically, I would like to give platelet concentrate, fresh frozen plasma.
Yes. Why would you not choose packed RBCs?
Yes, ma'am.
Why would you not choose to give packed RBCs?
Because this patient will need a lot of blood, ma'am. And if we give huge volume, then there might be volume overload.
One volume overload, and then RBCs are containing what?
Oh, RBCs, they might, the breakdown of RBC, if it is stored blood, there might be hyperkalemia. There might be, if there's other complications of massive blood transfusion might develop, like hypothermia, bleeding tendencies and all.
Yes. Okay, good. Can you, you told me about ABO blood group. What is important when you're doing cross-matching of ABO blood group? To know about what?
Cross-matching, we mainly have to know the antigen and antibody, ma'am.
Yes.
Yes, and here we take the donor's RBC and the recipient's plasma, and then we see the reaction.
Good. Okay. Last question. This patient's blood pressure was high, and respiratory rate was also high. Heart rate was also high. How should this patient have been, and patient was febrile as well, how should have this patient been managed?
For the management, I'll start with the ATLS protocol as per the and following the ABCDE approach.
Yes.
Since this is a trauma patient, I will first of all I'll assess the airway and also stabilize his cervical spine with the C-collar.
Yes.
And I'll see whether the airway is intact. If the patient is conscious and talking, I'll consider the airway is intact, and I'll check for if the patient is not conscious and not responsive, and I'll see for any foreign body, any area of facial injury, any blood, and then do the necessary. And then if any airway adjunct, basic airway adjunct or invasive airway adjunct is needed, then I'll proceed that way. Then I'll go for breathing, where I'll check the breathing pattern, respiratory rate, chest movement, any abnormal sound, and percuss, or and then go for that. Then I'll go for circulation. Here, the most important is also circulation, because patient has lost a lot of blood, and possibly patient would have presented with shock, whereby I'll open 2 wide bore cannulas and start resuscitating the patient with 2 liters of warm crystalloid, and also connect the urinary catheterization to monitor the urine output.
Okay.
I'll continue.
This patient has, sorry, I have to interrupt you. This patient has decreased to nil urine output in the last few hours. Why do you think? What has happened?
If it is nil, 0, then first of all, I'll consider if there's any blockage in the catheter.
Yes.
I'll flush the urinary catheter and then see if there's urine. And if the urinary catheter is not blocked, then I'll consider any other pre-renal or renal causes.
Very good.
Then I'll correct the hydration status.
Post-op case, so definitely there is shock and acute kidney injury possible. So many reasons, and DIC as well. So yes, good, very good, very impressive. Thank you. Where is your